I am Dr. Swarupa Mitra from Rajiv Gandhi Cancer Institute and Research Center. So let us talk about the cancers which affect women more commonly. So these are the cancers of the breast, the cervix, the uterus, and also the ovaries. So these are all the gynecological cancers. And other than that, we have the colorectal cancer, the lung cancer. There are many other cancers, but these are the common cancers which generally affect our women. What are the gynecological cancers which are common in women? So gynecological cancer means everything, all the cancers which can appear from the gynecological tract. So mainly these are the uterus, cervix, the ovaries and endometrium and the vagina. Of course, fallopian tubes are also there. So the common cancers which we see in our women, gynecological cancers, these are the endometrial cancer which occurs from the endometrium, the cervical cancer which occurs from the mouth of the uterus which we call as a cervix, the vagina which is the path of the delivery, that is, it leads from the cervix to the outside, and the ovaries. So these are the common cancers which women are affected with. How do we detect these cancers? So overall, there is no sign which detects cancer. So when we talk about all these cancers as a whole, for breast cancer, ovarian cancer, endometrial cancer, they are mostly a lifestyle cancer. Of course, there is a link with some genes that is being hereditary. So family history of having ovarian cancer, uterine cancer or breast cancer is a risk factor. Having a child at an age later than 30 years is a risk factor. And lifestyle, that means obesity. So these are the overall risk factors for developing these cancer. For cervical cancer, the risk factors are a little less because these are seen more in the lower socioeconomic group, and so the menstrual hygiene, having larger number of children, worse sexual hygiene, these are a risk factor. Now, what are the symptoms? When do we think that we may suffer from cancer? So, in a nutshell, any lump anywhere in the breast, in the neck, anywhere outside in the body may signify cancer, and these lumps are generally over a long period. They are painless, and then you must go to a doctor to see whether they are cancerous or not. Any bleeding, any abnormal bleeding from the cervix, the vagina, from mouth or anywhere in the body, they have to be investigated. Any change in the voice, any difficulty in swallowing, cough which is not being corrected since a long time, a very rapid unexplained loss of weight. So these are factors which should be looked at. Like I say in all my videos, any symptom which is bothering you for more than 3 weeks and they are not getting treated by the conventional treatment, they should be investigated to rule out a cancer. Now next we come that if at all we are detected with cancer, what do we do? So all women, breast cancer, cervical cancer, ovary cancer, colorectal cancer, surgery and radiation do constitute a large chunk of the treatment. So surgery, so which one you need, the doctor will definitely tell you, which depends on the biology of your disease and also on the stage of your disease. So surgery, radiation, other than that you have systemic treatments which are chemotherapy, targeted therapy, immunotherapy, hormone therapy. So there are many treatments which are available for almost all cancers. And how do we protect ourselves from cancer? Yes, screening. Screening is very important. For screening a breast cancer, we have the breast examination, self-breast examination, the mammography. So these you should take help from your doctors at how to go about them. For cervical cancer, we have the pap smear, and colorectal cancer, we have screening, which is occult blood and stool or colonoscopy, which may be required on a yearly or a 2-yearly basis, depending on what your doctor guides you. And above everything, maintaining a good lifestyle, having good food, exercising and shedding the extra amount of weight and staying happy and stress free.